Thank you everyone for joining us today and welcome to this webinar titled Implementing the Wisc Model 5 Years Later, Perspectives from CDC and ASCD. As a quick introduction, Sophe is a nonprofit organization founded in 1950 dedicated to providing global leadership to the profession of health education and health promotion and to promote the health of all people. Members of health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. Please plan to join us at Sophe's 21st Annual Advocacy Summit held October 19th to 21st, 2019 in Washington, D.C. We encourage you to visit the Sophe website for additional information. Now I am excited to introduce Christy Kay, President at Health Empowers. Christy has served as a consultant with Sophe on our school health team. She will talk a little bit about Sophe's school health project work under our cooperative agreement with the CDC and introduce today's speakers. Christy?
Thank you, Deanie, and good afternoon, everyone. The pollen is in full swing here in Georgia, so I apologize for the raspy voice, but very excited to present to you two dynamic speakers that will provide perspective on the implementation of the whole school, whole community, whole child, or often referred to as the Wisc model. They've been doing this work through CDC and ASCD, the nation's leading health and education organizations, and these two entities came together to conceptualize for us the links between health and learning. The Wisc framework has been based on the foundational concepts of both CDC's coordinated school health model and ASCD's whole child approach. The model has had broad-based appeal for both health and education professionals alike, and is helping us all to better understand the symbiotic nature of health and education, each benefiting the other. We all know too well that students cannot learn if they are not healthy and safe, and subsequently, they learn better if they are engaged, supported, and connected. Today's webinar will provide us with an update on the implementation of the Wisc model in states and districts across the country, including successes and challenges. The perspectives and examples will be provided from CDC's Healthy Schools and ASCD's Whole Child initiative, along with strategies and resources each organization is promoting to support and encourage the use of this model. Our speakers today are Ms. Holly Hunt and Mr. Sean Slade. Holly leads innovative projects in research and application, evaluation, and program and professional development at CDC. Prior to joining the branch, she was the Deputy Director for CDC's DASH, or Division of Adolescent School Health, responsible for the overall management of division operations and establishing effective partnerships in key national, federal, and nonprofit organizations that are working to improve the health of youth. Mr. Slade is the Senior Director of Global Outreach at ASCD and has been promoting and expanding the whole child approach across the United States and globally. Since joining ASCD, he has directed the Whole Child and Healthy School Communities program and was instrumental with the Wisc model. He's also directed and moderated the Whole Child Symposia. So without further delay, I would like to introduce and turn the presentation over to our speakers. Holly, I believe you're kicking it off.
Actually, thanks, Christy. I think we are turning to Sean to start us off.
I'm sorry, Sean.
That's okay.
That's okay. We work well in unison. We're a good example of health and education working together, aren't we, Holly?
There you go. That's right.
Exactly. So we are As Christy pointed out, we've been involved in this work not only for the last 5 years around the Wisc model, but for most of both of our careers, either from an education perspective or from a public health and school health perspective, as with Holly. And we probably have too much information to share to try and compartmentalize that into a 1-hour webinar. So what we've tried to do is break up this webinar into some sections. I am going to give a quick overview of the Wisc model just on the off chance there are some people who are part of the webinar who are not fully aware of it, or more likely there are some who may be listening to this recording who may not have come into contact with it prior. So we'll spend about 5 minutes just going through the model to make sure people know what we're discussing. But then I'm really going to focus on the growth and educational infusion of the Wisc model over the last 5 years. And I'd say especially the last year or two, because what's been remarkable is just to see how much it has spread across the U.S. and how much it has infused educational discussion and also policies. We'll then turn it over to Holly to talk about the growth and the health implementation. And we would be doing a disservice to others in this field or in these fields if we didn't also highlight some of the tools that are available, not only via CDC, not only via ASCD, but via a number of leading school health organizations and departments around the country. Because I'm sure Holly will agree, what's been remarkable is really to see how this model has been accepted and has been adopted across the states. It's been actually quite wonderful to see. And then we will try to make time for questions. We will give our email addresses out, I believe on the next slide as well. And if we don't by chance come to your question at the end, please feel free to send us a direct email and we will get back to you. There are our emails. They're both very, very complicated. First initial, last name, and at our relevant organizations. I'll leave it up there for a couple more seconds in case people want to write any of these down. So let's talk about the Wisc model. So this, as Christy was pointing out, was launched 5 years ago, and it's probably almost 5 years to the date when we actually launched it, because we launched it combined at both the ASCD annual conference, which is held in March, and then also at the Sophe annual conference, which at that year, I believe, was in early April. So we're almost at 5 years exactly to when we launched this model. And you can see just by the model how the different organizations have intersected. You've obviously got the child at the center, surrounded by ASCD's tenets of what we believe a successful school and a successful education should be based around. Those tenets, by the way, are based on Maslow's hierarchy. So obviously, if the child is not healthy or does not feel safe, it's very hard for them to be engaged in the learning process, supported and then challenged. And as a former physical education teacher, I know too well that the importance that health and well-being, not only physical health, but also mental, social and emotional health, play on bringing out the full potential of each child. You'll then see also the blue components, the school health components, which come originally from the traditional coordinated school health model, but that one had 8 components. And what we did with this new model was break apart a couple of those components to really put more emphasis on them. For example, the community involvement and family engagement were pulled apart because those two things are necessary, and we didn't want schools or educators or even health services to think that just because the community is involved with the school, then it's not important whether the family is engaged. And likewise, if the families of the students are engaged in the school, that does not mean that the school should not be interacting frequently and consistently with its community and also with its services. So we wanted to emphasize that those two things were critical. And likewise, we also pulled apart the physical environment and the social emotional climate for a similar reason. Just because you have taken the asbestos out of the schoolhouse ceiling does not mean that you do not need to worry about the climate, the learning climate inside the school. And just because I may have a wonderful rapport with my students inside the school, that does not mean that I cannot ignore lead in our pipes or some other contaminant in the school. So these two things are also important. And then, and I always call Lloyd Colby out for this, who was part of both the original Coordinated School Health model, but also our Wisc model, and leader of DASH at CDC for a number of years. He really emphasized how this model needs to sit inside the community so that it is open to the community, it accesses resources from the community, but it also starts to interact and give back to the community. So it's almost an ecosystemic look. There are videos on both the CDC and the ASCD website that outline what I've just gone through in more detail. But really the purpose of this model was to frame and to bring health and education together. Now that's not to say that it hadn't been trying to do that for a number of years. We had the traditional Coordinated School Health model developed out of the article from Lloyd Colby and Diane Allensworth in 1987, striving to not only highlight the health needs that a school needs to focus on, but also trying to infuse that back into the school and education setting. But the issue was that as time went on, we saw more and more that education was being focused more around content and academics, and there was less emphasis being placed, at least from an educational perspective, on the health and well-being and the healthy learning environment of those students and of those teachers and of that setting. So what we really tried to do was have a discussion of how do we bring these two sectors together? Because very often we're serving the same child in the same location, often because of the same issue, but we're doing it in silos. So the aim of this model was to try and bring the conversation back together, to utilize the strength and the needs of both sectors to improve. And one thing that I've been pushing, and I was actually on a phone call this morning with somebody from Arizona who's been doing a lot of this work in their school. What I've been pushing is, from both an educational and a school health perspective, we need to change the mindset and the understanding of what our real purpose is. Our real purpose in education is not to deliver content and not only to have the students pass an algebraic test. Our purpose in education is help to develop future citizens who are ready to enter society, be part of society, be active in society, and be fully prepared to do that. Hopefully, at least when they leave schooling, but hopefully as they're going through schooling as well. So from an education perspective, we've had to change the dialogue away from academics only to a more holistic whole child focus, where it is our role to help the child develop socially, emotionally, mentally, physically, as well as cognitively. And from an from a health perspective, it's been changing the role of health to be more than just a conduit or a support system for academics. Now, I've been pushing back against the equation which says that the healthier student will do better on test scores, not because it's not true, because it is true, but I don't want the conversation in education or in school health to be so narrowly focused that the only reason you want healthy students is so they can do well on a standardized test. I want us to have healthy, engaged, happy, fulfilled students so that they are happy and healthy and fulfilled. That is a goal unto itself. And both education and the community and the health services play a core role in that. As I mentioned before, we had the coordinated school health model developed by out of that article by Diane Allensworth and Lloyd Colby, the comprehensive school health program exploring an expanded concept. And that's really been a leading model in the US and globally for a number of years. In 2007, ASCD launched this Whole Child initiative. Not that we hadn't been talking about it or doing that work prior, but we saw that there was a need to draw a line in the sand to say we need to redefine what a successful education and a successful student looks like, because it's more than just the cognitive. What has come up in the last couple of years as we developed the Wisc model, which is far easier to say than the more elaborate but very descriptive whole school, whole community, whole child model, is that there have been discussions about how these two models play with each other or interact with each other. So is the Wisc model the whole child model? Is the whole child the Wisc model? Basically, they are the same thing. You will find all of those school health components highlighted inside our indicators under our tenets of healthy, safe, and engaged. We talk about health education. We talk about staff wellness. We talk about social emotional climate. We talk about support systems, school psychologists, counselors, physical activity, nutrition. What this Wisc model does is it basically is talking to an audience which is made up of school health personnel and people who have worked in that field for a number of years. And what it does is it pulls out and it highlights areas that need to be focused on as a core starting point. So whether you're talking about using the whole child, the green, or whether you're talking about using the Wisc model, they are the same thing. And they just pull out slightly different parts of each one depending on the audience we're talking to. So we have had over the last 5 years the majority of school health associations, the majority of state departments of education and health adopt and start to use the Wisc model. Now, what's been lovely about that is we've seen infusion into departments of health. We've seen infusion into school improvement processes. We've seen infusion, as I'll showcase in a couple of slides, into the Every Student Succeeds Act, which is the state policies that each state is required to submit. So we've started to see an infusion of the Wisc model into education. We've also seen whole child as a phrase and as a term and as a focus be adopted and picked up more and more by education associations and educational institutions. Now, from my perspective, it does not bother me whether people talk about whole child and use the framework or whether they talk about Wisc and use the framework, because they are the same thing. It's the same ideal, the same focus. Each model pulls out slightly varying aspects of one another. And the benefit, though, about the Wisc model, again, to go back to what the input of both CDC and also Lloyd and others, is the fact that it really highlights the needs of the support structures and the services that every school needs to make sure that they are a functioning, healthy, effective learning environment. And that includes the interactions with their local communities as well. I did talk a second ago about the Every Student Succeeds Act, or ESSA, because we like to have acronyms in the field of health and also the field of education. So if you hear ESSA or ESSA mentioned, it's the Every Student Succeeds Act. And it's basically the extension of what was known as the No Child Left Behind Act back in the early 2000s. On this map, and this is just some internal surveying that we've been doing about how widespread the Wisc model has become in the last 5 years. And if we look at state departments of education or state departments of health who highlight, who showcase, or who have written it back into state-level policy, the Wisc model, we now have 39 states highlighted there in orange that have it at their state level of education or their state level of health, which I think personally is quite remarkable within 5 years for that to happen. If we then take it even further, states that have written the Wisc model in particular, using its full definition into their state ESSA plans, there are 13 states that have now done that. States, by the way, such as Alabama, Arizona, Arkansas, Colorado, Georgia, Illinois, Maine, Michigan, Montana, New York, North Carolina, Oklahoma, Oregon. There may be some more than that, but this was the last review that we were able to do. So this is where these are states that have written and showcased the Wisc model directly back into their state educational plans, which means they will be doing it, and it's now passed into their legislation at the education level. Many of you will have known as well that Robert Wood Johnson Foundation gave around about, I believe it was $6.5 million, which is extremely generous grant giving out to a number of organizations to do research around the Wisc model in particular. Child Trends, which is a wonderful organization based here in the Washington, D.C. area, did a more detailed look at policy infusion at the state level around the Wisc model. And not only talking about the Wisc model, but parts of its components, the school health components, and how they have been highlighted. And they indicated there are 10 states, Arkansas, Colorado, Connecticut, Florida, Illinois, I believe that's Minnesota, Mississippi, Tennessee, Texas, West Virginia, where it has deep infusion into their state-level policies. Again, this is focused not only on the Wisc model per se, but was focused back onto the individual school health components, the 10 blue components. And so you start to see the map is starting to fill up. There are some states where they have not only have it at the state level, but they also have it written back into ESSA, and they also have deep infusion at the school health policy level as well. Now, from a personal perspective, knowing the whole child work and the coordinated school health work that has been going on around the country over the last 10 or so years, I also know that some of those states that we hadn't highlighted as yet are also doing things which are very active around whole child or coordinated school health. Now, these are not the only ones, but I wanted to highlight that even some of these states that haven't yet been highlighted, such as Hawaii, such as California, such as Virginia, are also doing some wonderful things around whole child and around coordinated school health. Tennessee, for example, has not made strides with the Wisc model, and one of the reasons they haven't is that they have been doing an outstanding job using the coordinated school health model. And they had systems built up and coordinations built up in Tennessee that meant there was no need to necessarily change. And I'm sure Holly can chime in a minute about it, but my perspective is the aim that we're trying to achieve here is alignment and integration between health and education. And if that happens via whole child policy, fantastic. If that happens via the Wisc model, as it's showcasing here, fantastic. If that happens via states or entities using a coordinated school health approach, fantastic, because the objective here is not the vehicle, the objective is the outcome, which is a healthier, more connective, more safer and supported learning environment for our children growing up. One example I wanted to pull out around ESSA, the Every Student Succeeds Act, was Illinois. Because Illinois has not only highlighted and spelled out putting the Wisc model into its ESSA plan, but it also has it front and center in its mission and also throughout the whole document. It calls out whole child. It calls out the need to focus on a safe and healthy learning environment. And then it even goes further because it starts talking about the need to align educational funding around Title II, which is predominantly around professional development funds, and Title IV, which is primarily around safe schooling funds, and focus those or put them under the umbrella of the Wisc model. So Illinois is doing an amazing job about taking what we've been talking about for a number of years and actually putting it into action and putting it into some of their policy directions as well. And as you can see from the highlighted text there, and you can also see from the presence of the model, they really call out the need for schools and their communities to work together. For any of you who are involved in on the school health side and may not be aware necessarily of the Every Student Succeeds Act, I would recommend that you go back and Google it for your state and have a look through. Or I would recommend you go back on these slides to see if it has been highlighted as something which is called out in your state's ESSA plan. I don't have the website handy, but I do know the work of CAN Guidance has been instrumental in providing fact sheets around the Wisc model and its adoption into ESSA. And that's CAN Guidance, C-A-I-R-N Guidance, based down in Kentucky. And if you want more information about the Every Student Succeeds Act, we do have a web page dedicated to it since we are an education association. And just a couple of years ago, the American Institutes of Research did an accountability run around what states are using as some of their measures, because besides the need to start to erase some of the funding and erase some of the policies, there was also a call in ESSA for states to actually have a non-academic accountability process at their state level. So something that showed that students and schools were succeeding that was not an academic measure. AIR went through a couple of years ago to look to see what states were using, and 14 states had put down things around conditions for learning. Now, those were things around school climate, access to health services, school safety measures, and a focus on social emotional learning, all of which are things which relate back to the Wisc model, and all of which are things which relate back to school health and health services. Another 26 states at the time had focused on chronic absenteeism. Now, chronic absenteeism is really a proxy for students who either are not healthy enough to go to school, do not feel safe at school, or do not feel engaged at school. And so there is definitely integration there between the health and education sectors, between health and well-being issues. What has been remarkable over the last 5 years, and by no means has it been solely the work of ASCD or solely the work of CDC, but rather it's been the work across the country from different stakeholders, is that Wisc has become the next evolution of the coordinated school health approach. It has become the model and framework for aligning education and health and the community, and it has become the focus for a lot of agencies, associations, and funders who are invested in the health, well-being, growth, and development of our children and youth. I do know offhand that we have had not only Robert Wood Johnson Foundation step up with funding, we have had United Way step up with funding, we have had Blue Shield step up with funding, we have private hospitals that have stepped up with funding, and I expect that to continue for the next 5 years moving on. That gives you an overview, hopefully, of education. I'm going to hand it over to my better colleague or better half, Holly, to take over and give you an outline of where she thinks we are regarding the Wisc model and health.
Thank you, Sean. And actually, before I move into my piece, which I'm going to go ahead and switch gears a little bit into lessons learned and what we know about successful adoption of the whole school, whole community, whole child. But I wanted to comment on Sean's earlier reference to Tennessee and the fact that what's important is that we see folks creating a healthy environment for students that encompasses those components that are, reflected within the Wisc model. And there are many, many states that have, and I would venture to say districts and schools, that have taken the model and tweaked it slightly or changed it up to reflect their particular interests or community values or what's most important to them. And, Tennessee is really just one example where they have legislated coordinated school health and had that in place for a very long time. And, not to speak for Tennessee, but from our view, they are, based on what we know about the work they're doing, and they're implementing what we consider to be a Wisc approach. But again, you'll find that in many states, folks are still using the terminology of coordinated school health, but they are going beyond and looking more at that whole child approach and working to incorporate those tenets. And, as Sean had said earlier, we have seen so much traction, not only in education, but in the health departments as well, because I think, as many of you may know, we supported all 50 state health departments for the previous 5 years, and they were able to work with their counterparts in education and really strengthen the work they were doing to support healthy school environments. Now I'm going to move us into what we've learned from the literature about adoption of Wisc as well as coordinated school health and the Whole Child. We know from the literature the infrastructure is very important, both at the state, district, and school level, and it's absolutely essential to facilitate adoption. And again, that may look different from district to district, school to school, but there are specific recommendations for supporting or facilitating the adoption of a Wisc approach, and those include having a school health coordinator, a district-level school health advisory or coordinating council, and school health teams or committees. I mean, these are some of the most important pieces to infrastructure. I'm not going to read what's on the slide because you all can do that, but I did want to highlight some of the most relevant ones that seem to rise to the top and be particularly influential. And of course, one of those is the effective use of data for continuous improvement, and that refers to, in part, the use of a systematic assessment and planning process, to help the coordinators and teams identify what their specific needs are, their strengths, weaknesses, and to prioritize, what they want to do to strengthen school health policies and practices. And as far as what we've learned from the various studies, the two pieces that appear to be particularly influential are the principal as the leader and integration of Wisc within the school improvement plan. So as we move on, we'll talk more about what we're working to do to help facilitate the inclusion of these pieces. Now, some of you may have seen an article that our folks did that was published in the Journal of School Health just this month, and it's an analysis of practices implemented in schools to support adoption of a Wisc approach. And it looks at variables such as I just mentioned before, having a coordinator, inclusion of Wisc components in the school improvement plan, collaboration, and professional development for staff across the Wisc components, all of which we know are critical. And it was really unfortunate to see that health education had the lowest percentage of supportive policies and practices. So we clearly have a lot of work to do, and I want to go into some of the things we're doing to help increase those numbers. One of those activities is our cooperative agreement with state departments of education, and we just launched this last June. They're nearing the end of their first year, and what we've done in terms of the expectations in this cooperative agreement, which I see there are quite a few folks on the webinar that are part of our cooperative agreement. So what we've done is for this one, the most previous one, we focused pretty much solely on evidence-based strategies. But in this cooperative agreement, recognizing the importance of supporting that infrastructure, we've gone back to supporting those, lessons learned, those strategies that we know will help states and districts and schools within the states adopt a Wisc approach. And even though we are addressing specifically physical activity, nutrition, and management of chronic conditions in school as well as in out of school time, the expectations very much support a Wisc approach, and they include a strong partnership with the state health department, support of school health councils and teams, implementation of the school health index, which we'll talk a little bit more about shortly, and a statewide coalition representative of the components within the Wisc. So while the grantees are implementing a statewide approach while providing intensive TA and professional development, they're also working more closely with some specific priority districts. Now you can see from the map here who we're funding. I also want to point out, I don't want us to spend too much time on Tennessee because folks get a little sore when you talk about Tennessee because they have more money than anybody else. But we have actually supported them to provide professional development to the rest of our grantees in the areas that are cross-cutting but impact the outcomes associated with our priority areas. An example, we have an event coming up for all the states where the focus is on mental health and social-emotional learning, as well as addressing equity. So we know that all of those things impact all risk behaviors and conditions for young people. So we're working to be inclusive of a more comprehensive approach and to truly more adequately address some of those components within Wisc that we are not at CDC as strong in all of those components as we would like to be. Many of you are familiar with a number of our tools. You see the websites here for each of those, as well as some of the tools from some of the other organizations. So we're going to touch on each of these because we, in particular here at CDC, what we consider to be most supportive to the field is to translate the evidence and put it into user-friendly tools and resources, because it doesn't do much good to know the science and not help people be able to apply it. So to that end, our most comprehensive tool that is framed around the Wisc model is the School Health Index, and I'm sure many of you are familiar with it, but for those of you who are not, we call it the sheet, and it addresses, it's a self-assessment and planning process, and it's user-friendly. It's not anything that's shared outside of the school, and once it's completed, once the school completes it, the school is able to develop an action plan to improve the weaknesses identified in their policies and practices. Again, going back to what we know about lessons learned around Wisc adoption is using data for continuous improvement. And again, ideally, a school will incorporate the results into the school's improvement plan. Now, the modules are in line with each of the components of Wisc, with one extra one, the first one being school health and safety policies and the environment that identifies the most important health and safety practices that all schools should have to ensure that students or staff are not exposed to any risk. We do have an online e-learning series around the School Health Index, and we also are in the process of updating our SHE training manual and hope to very soon be providing an updated training for folks. Another tool that we have spent a great deal of time on and solicited some wonderful input from the field to develop is our virtual healthy school. And what the VHS, as I'll refer to it now, is it gives the user a view of what adoption of the model might look like in a school. And again, Wisc is not prescriptive. It's going to look different in every school. And this one features a more well-resourced school. But we worked with Sean and others at ASCD in the development and framework shortly after the release of the model. And it took us quite a while to get it out to the field, because those of you who have worked with us know that creativity and animation are not really our strong suit here at CDC, but we have definitely enjoyed our foray into avatar land, and we've gotten a lot of positive feedback. And I want to tell you a little bit about how it works. The VHS has 13 rooms or spaces, For example, it's got a gym, a staff lounge, a number of classrooms, a cafeteria, school-based health center, and other rooms, and it also contains a comprehensive list of resources. Now, my favorite is one that you see here, the conference room. And in it, the school health team that you see here is, they talk about different subjects related to improving their environment based on the results of completing the school health index. Now, within each room, there's a clickable set of 7 objects related to creating a healthy and supportive environment. They're all evidence-based. And for example, in the playground space, there's an adaptive swing. And when you click on it, a pop-up screen comes up and describes how the playground supervisor was able to make the playground more accessible by applying for a grant and implementing a community fundraising campaign. And as a result, this is all the playground supervisor doing this with a team of folks and with community support. So it just talks about overall how they change games to be more inclusive. And then within that same pop-up screen is suggestions for action on what a school health coordinator or team can do to also improve the playground and make it more inclusive. Now, that's just one example, and that's just one object. And like I say, there are 7 in each room, and they pop up, and it's a conversation or it's a dilemma or a situation, and it really is intended to be hands-on and provide examples of what school staff, parents, and community members can do. I want to show you briefly, I've got just a very, I don't know that it's going to work. It was a brief video. I don't think in this format it's going to work, but you can see the front of it here in each of the rooms in it, and Principal Paul here will walk you through each of the rooms or the spaces. What I was going to show you on the brief video was the community map, which we've actually named the community of Colby, in honor to Lloyd Colby. And so it actually has a community of different places where students can be referred. And this particular one has a behavioral health center, and it talks about the services that the school is getting through that behavioral health center. Next up for the Virtual Healthy School is a mobile-friendly version due out the end of September. Now, I did want to highlight some of the tools that the Division of Adolescent and School Health has that are all easily accessible on their website. They have a nice video, too, that shows how their priority areas related to sexual health are addressed through the Wisc model, as well as additional information about each piece of the model and how it relates to sexual health. This is a piece we're really excited about. It's in process. We expect it to be out at the end of May. We're creating these one-pagers that illustrate, and I know you can't really see this one, but it's on nutrition, and it shows how nutrition is addressed through each of the 10 components, not just the nutrition component. And we often get this question because, again, the Wisc is intended to be comprehensive, and we want folks to be able to see examples of how social-emotional climate impacts nutrition, how it impacts physical activity and school health services, and so forth. Those will be available on our website. The National Association of Chronic Disease Directors has developed some wonderful resources for implementation and adoption of Wisc. One is integrating health and wellness into the school improvement plans. Another one is a guide for implementation, and another piece, Achieving Impact, that features success stories of our grantees that were funded in our previous cooperative agreement. And just to show an example of what's in their guide, and I actually adapted this for a slide, but as I was saying, illustrating how one piece of this is addressed through the entire 10 components. And you can see here the district goal of school connectedness with the health priority of addressing social and emotional health. And then you can see how each component outside of the social and emotional climate addresses this particular goal. Also from NACDD are 3 videos that they worked to develop in collaboration with school districts in Arizona and Vermont. And these feature school staff and superintendents, principals, and they address 3 different areas. One is the benefits and impact of the model on student learning and health. Another is administrator support and commitment, and the other is ease of implementation of Wisc. And for those of you who have not seen the special supplement on Wisc that was published in November of 2015, you see here some of the various topics that are included in this issue that was devoted to the Wisc and was intended to, give folks a leg up on what they can do to adopt the model. It includes the connections between health and academics, the lessons learned, how to align policy and processes, and then the role of communities, as well as other topics. And it's available online at no cost. So I would encourage you to check that out. Sean, I'm going to turn it back to you to talk about the ASCD tools now.
Yeah, certainly. And a couple of the questions that were being asked about tools that people can use to either speak to different audiences, including school boards or principals or superintendents. Holly highlighted a couple of those just now. Anything which we believe is directly relevant to educators, superintendents, principals, we host them on ascd.org/Wisc. And the journal that Holly just talked about as well is up there as well. So from our perspective, we're aware that we have a wide audience, but our primary audience from ASCD is talking to educators. So, and I know that we're running short on time, so I'm going to go over the next couple of slides briefly, just give you so you understand what's there and available, because there is a lot out there. And between Holly and myself, we've only really scratched the surface on things that are available. One of the things we do have on our site is access to the free ASCD School Improvement Tool. And this is a tool which has been designed as a quick, simple needs assessment designed for school principals to get them understanding the whole child approach and also the Wisc model. So anybody, whether they are a member of ASCD or not, can go on and utilize this either individually or for their schools. And you go through the indicators that relate back to Whole Child and relate back to that Wisc model. And you obviously will get scores related to, as you can see there on the screen, related back to the Whole Child tenets of healthy, safe, engaged, supported, challenged after you have done this survey. But you also get scores related back to the 10 school health components that Holly has been talking about and we have been focused on in this webinar. Now, by no means does this supersede or supplant the School Health Index. The School Health Index is far more of a deep evaluation tool. I would almost describe the School Improvement Tool as an introductory tool for educators around the Wisc model. But it gets them to start to see how those school health components play back into what they are doing regarding school improvement at their school. Again, that is a free model. Another thing, or another two things that you may want to look out for on our website. One is what we call the backgrounder, which is a document, and again, this is free, it's on our site, which speaks about why health and education need to be concerned about the health and well-being of the students. And this, again, talks back to school principals and superintendents. And then the other document, the more colourful one here on the right, gives examples about what states, what districts, what associations, what schools have done in order to implement and use the Wisc model. And it has direct links back to examples of policies, examples of presentations, and also connections back to people that have done some of the work as well. I am aware of the time, so this is the Child Trends report that came out recently. You can download it at childtrends.org, and it showcases the policies that they have come across in their research around the school health components in the Wisc model. And I imagine you'll be seeing more coming out from them and also more coming out from Robert Wood Johnson Foundation regarding this. Aligned to that, the State Boards of Education have also put an interactive version of that onto their website, which you can see at statepolicies.nasb.org/health. One thing that I added this week as well, because I wanted to give them a shout out, but the University of Connecticut have been doing some phenomenal work around the Wisc model. And if you have not come across their work, you should look into it. But they have a series of not only state-level policy or policy briefs regarding the model, but also a series of videos. And I am sure you're getting the impression that there is more and more being developed around this model for the different sectors and for the different audiences than we can even get to or scrape in this webinar. I will also give a shout out to Action for Healthy Kids based in Illinois, because the work that they have been doing with their volunteers and their schools and districts over the last number of years has been phenomenal as well. So there are a number of organizations out there where people can access information. Holly, do you want to chime in around some of the other things coming out from Sophe?
Yes,
or is
yes.
this? Yep.
I'm going to say it really, really quick because I'm really excited about some training modules that Sophe is putting together to assist with the development and enhancement of school health teams. Again, school health teams and councils, I was emphasizing the importance of that earlier. So look for opportunities to learn more about that in the future. Sophe is also developing a number of WISC fact sheets related to community support, youth voice, and equity, as well as a social emotional learning brief that will specifically help the public health field, particularly school health professionals, understand how SEL supports school health programming.
Wonderful. And as we mentioned before, and I apologize that we rushed through the last series of slides, Holly is very approachable and would love to answer some questions. I would also love to answer questions as well. So if there are additional things that you have and you don't find the answers, you have our emails. You can contact us. And if I don't have the answer, I probably know somebody via the different organizations or associations that will have the answer. So I think between myself and Holly, we probably have connections with the majority of people. Any final words, Holly, before we allow our captive audience to move on to their next meeting?
No, I don't think so. We just appreciate you all joining us. And like Sean said, please don't hesitate if we can be of help in any way. And many thanks to Sophe for hosting the webinar.
Thank you very much. And I believe that we turn it back to Christy.
Well, Deanie, so thank you to you both for this amazing presentation. I'm sorry to the participants because I see we did have a couple of questions. So if I don't know if Holly and Sean, you want to try to quickly answer these questions, or if you would prefer to have people email you directly. Um,
On my end,
just in terms of like the timing.
I actually have to get to another commitment. So I'm happy if people want to just send me an email.
Wonderful. So
Thank
let's
you.
plan to do that. No problem. Let's plan to do that. Again, their emails are on the screen, and so feel free to take note of that. And we will go ahead and close out. So on behalf of Sophe, thank you to our presenters again and to all of our participants. Today's webinar was recorded and will be archived on our Sophe's Core within 2 weeks. So please take a moment and complete the brief feedback form that will pop up in your internet browser following this webinar. Also, please note that you will be receiving a quick survey just to get some quick feedback from you all on the content of this webinar. And again, if you're interested in continuing education credits, please visit Sophe's Core. Thank you. This ends our session today.